Hello, my name is Rachel B., and I am a Liberty University nursing student trying to get my master's in nursing education. So, to begin the lecture, I have started with a video describing the sampling process. It really breaks down the concepts so that they're easy to understand, as the book can be confusing. So from there, I'm going to start my lecture, and at the end of the lecture, we have a group activity planned, which I have as part of the PowerPoint, and it's clearly laid out in my teaching plan. So let's begin. So this morning we are going over population management. Population management is better known as sampling and the sampling methods that we use in research. So let's start with a big question. Why is sampling important, or why do you think sampling could be important? So sampling has to do with our research design. If our research design is not valid and accurate down to the very jot and tittle, we're not going to get to evidence-based practice, which is the goal. We want evidence-based practice. That's what leads to better patient outcomes, better nursing care. So that is the goal, and that's why we need to work hard to make sure our sample is representative. So, a representative sample is one that has the characteristics of the rest of the population. That's an important term to know. So when you have the same characteristics, you are representative. When you do not, that is what we call sampling error. Excuse me. So, in having the same characteristics as the population, then you will have more accurate results, more valid conclusions. And that's what will make a difference in our patient care. So, this is a picture directly from your book. And what it does is it breaks down the concepts. So first we're going over this idea of population, which is out and around target population. Then dealing with accessible, and then the sample itself. We'll also review the selection process and what it means to have a generalization of results. The population is the entire set of elements that meets a certain criteria. So this could be people, it could be animals, it could be things, it could be specimens, it could be anything. So for our class, let's consider our population to be pregnant females. You can see how that includes animals and it includes people. It's very broad. Target population is those that meets the specific criteria for our study. Our study is going to be on teenage Asian pregnant women. And those are everyone that meets that criteria in the whole world. So that is the difference. We're getting more specific, but it's not a broad concept. It's a specific idea of what's going on in the world. Accessible population are those people that meet that criteria who are reasonably near the researcher and could be a part of the study. And from that accessible population, we get our sample, which are those who are actually going to be studied. One of the frameworks for all of this is, are our methods feasible, also known as efficient, cost-effective? We have reviewed this a lot in our research class. So we always have to think about feasibility in this process. Do you think it's important to have a sampling plan? With our sampling plan, we have a blueprint for our whole study and what the selection process is going to look like. What is the framework? What is the method for getting our complete sample that is representative of the population? So, also a very important part of the decision is determining the validity, internal and external validity. When you think internal, I want you to think of the word describe, and for external, think of the word apply. Internal validity does what's inside my study describe what's going on in the real world? Does my sample describe the real world? External, do the findings of my study, so we had our study and now we're looking outside of it, does it apply to the general population? That's that idea of generalizability that is so important. So what is the difference between inclusion and exclusion criteria? We've covered this before. Inclusion and exclusion criteria are not mutually exclusive. Inclusion are those specific criteria the sample must have in order to be a part of the sample. In our case, teenage Asian pregnant women in our area, let's say central southwestern Virginia. Exclusion criteria are not male, so forth. It is they can't have maybe heart disease, psychiatric disorders, terminal illness, things that could detract from the study or are not the point of why we're doing this study. So it could negatively affect the results. And it is our job to make sure this criteria is extremely specific. So we have two families of sampling. The first is probability sampling, which is random. Non-probability, which is non-random. Now, these two concepts do not just apply to quantitative and qualitative research. The only definite correlation is that probability sampling must be involved in experimental studies. That's the only correlation. So probability sampling is random. So this is different from random assignment. Random assignment is from our sample, we're deciding who gets the intervention and who does not. Random sampling is how we get to our sample. And here are the different methods. We have simple random, which is basically pulling names or data out of a hat. Very simple method, but when you're dealing with, let's say, a large sample size, this is not efficient or practical. Stratified random is when we have different groups or strata, demographics, things of that nature that are part of the population. We still want those demographics to be true of our sample. For example, we might want a certain percentage of our population to be Korean, Chinese, Japanese, Vietnamese, that kind of idea. We want our sample and the demographics to represent the population. So we'll use a random method to have the same strata. Cluster sampling is also known as multi-stage. We normally see this in geographic sampling. So here I have a picture of the United States for you, and you see it's divided into different community clusters. So in this sampling method, we start with the biggest cluster and work our way down using stratified or simple random methods from those clusters to get our sample. Systematic random is one of the most efficient methods of randomized sampling. It can be done using a computer program. This is when we start with a random number. Let's say from our accessible population, person number 15 is going to be the first person involved in our sample. Then every fifth person after her will be a part of our sample as well. So we go in those intervals until we reach our full sample size. Non-probability methods is non-random. This is normally used in nursing just because the samples are easier to obtain. Now, we have to go back to this concept of feasibility. Am I able to get a larger sample? Can I only get a smaller sample? Think critically about that to decide which method you're going to use. First is convenience, which we've already studied before in this class. It is the simplest method, also known as accidental, and it might not be representative. It's basically whoever is there you're going to use as part of your sample. Quota is the stratified random version of non-random sampling. So you're going still with that idea of demographics. For example, in this pie chart, we have different percentages of different races to be used in a study. So we want to keep those same demographics true in our sample. However, we're going to use a convenience method to get there. In purposive, we are choosing who's going to be a part of our sample. For example, if we're using maybe having a study on nursing, critical care nursing experts on their time management skills, we're going to handpick who we know has the best skills, is an expert in their field, in order to have a representative sample of what we're actually looking for. The snowball method is when you start with a small sample and you're trying to work your way up through networking. For example, if you're studying cancer patients. You can't just go to the hospital and say, hey, I need your information on all your cancer patients, because that would break privacy and confidentiality. So instead, you might know a few patients with cancer, interview them, and ask them to ask their friends, maybe people in their support group or online, to be a part of your sample size, so it networks to a bigger size. Theoretical is normally exclusively qualitative research. It's also used in creating grounded theory, when you're working from the ground up to build your theory. So this is used, think of an idea of a sponge. You're starting with a small sample and you keep going until the sponge is saturated. All your information is there, no stone has been left unturned. That is data saturation. And in theoretical sampling, you work till you reach that point, then your sample is complete. So, is it better to have a bigger sample? It depends on your study and different factors involved in your study. For example, in quantitative research, and many of these factors we'll see also apply for qualitative as well. If we have more of a homogeneous sample, we only need a smaller sample size. Excuse me. For our example for this class, the teenage Asian pregnant women, that's pretty homogeneous. We probably don't need a large sample size, where if it was a more heterogeneous sample, we want a larger sample size. If our instruments are not sensitive, they're not the best, we're worried that a small sample will not lead to accurate results. So we need a larger sample if we have less sensitive instruments. Also, again, feasibility. It always comes down to feasibility. Then we have the statistics reference with the power analysis. So tell me, what is a null hypothesis? We covered this before. So that a null hypothesis says there is no relation between A and B. Okay? No relation between A and B. The power analysis is that statistical answer we come up with that determines how big of a sample we need to reject that null hypothesis. Qualitative, you see we're seeing a lot of the same concepts. Study design, is it homogeneous, heterogeneous? The main difference here is data saturation. So we will stop with our sample if we reach data saturation if we're doing certain qualitative studies. It could be a very small sample at that point, but it doesn't matter because we have all the information that we need. So now we have come to the end of our lecture, and we're going to begin our group activity. Our group activity is going to review from the handout that I gave you. I will assign each group a question, and you will decide, are you doing qualitative or quantitative research, and which sampling method will you use and why. So I'll give you time to go over all of this, and then we'll review your answers together in order to gain some insight from each other's input. So let's begin this, and thank you so much for listening to my lecture. Have a good day.